Honourable member would love to have some way of reconciling what seem to be very different views of how common this is and how effective the response of the medical community has been to it. I'd love to resolve that. But I just want to say, first of all, just so we're clear, I don't believe that anyone, whether it's the provincial health officer or family physicians or others, I haven't heard anyone say that Lyme disease does not exist. I think what I hear them saying is that they believe the real incidence of Lyme disease is in the area of 5 to 10 cases annually in British Columbia. They're also saying that physicians are trained to diagnose Lyme disease, that physicians should be vigilant because Lyme disease does exist. Physicians should be vigilant about identifying and appropriately treating Lyme disease, but they don't believe that it is massively underdiagnosed. They do believe it exists, but is not massively underdiagnosed. So I understand that, in fact, the rates of Lyme disease diagnosed in British Columbia are comparable to those diagnosed in Washington, Oregon, and Idaho. The member apparently has a different view, and he can advance that in a question. But the detail I have is that Lyme disease is an illness caused by a bacterium spread through the bites of certain types of ticks. In BC, less than 1% of the more than 4,600 ticks tested carry this bacterium, and cases of Lyme disease here remain rare when compared to the eastern United States, where they're far more common, apparently. BC Centre for Disease Control monitors the province for Lyme disease, provides public alerts and information to physicians on risks, signs, symptoms of the disease. If a British Columbian is concerned about symptoms or exposure to Lyme disease, they can access diagnostic tests publicly covered under the Medical Services Plan. Where I think some of the division of opinion or division of thought around Lyme disease occurs is around the testing protocols that exist for Lyme disease. The BC Centre for Disease Control Laboratory Services recommend a two-tiered approach to Lyme disease testing. First, blood samples are screened with a sensitive enzyme immunoassay test, or EIA test. Then positive or suspicious results must be confirmed by a highly specific Western blot test before Lyme disease is positively identified. And this approach is also recommended by the Association of State and Territorial Public Health Laboratory Directors and the U.S. Centers for Disease Control and Prevention. So the BC Centre for Disease Control cautions against the use of invalidated tests for Lyme disease or interpreting results without appropriate guidelines, as this can lead to a number of false positive tests. For example, some private labs in the U.S. use a different standard of interpretation, thus returning a false positive result on almost every test. In the view of the BC Centre for Disease Control, a false positive test and hence an inaccurate diagnosis of Lyme disease can be harmful because, first of all, patients and doctors stop looking for other remediable causes or approaches to symptoms. Inappropriate antibiotic therapy for misdiagnosed Lyme disease can and has killed patients in the prime of their lives. And people suffering from treatable but debilitating conditions such as MS or Parkinson's disease do not receive appropriate therapy, which can lead to an unnecessary worsening of their conditions. So that is the view of the BC Centre for Disease Control, and I think the view of the great preponderance of physicians and epidemiologists and so on in the province. I think the member asked at some point, do we know of any physicians who share the view of Dr. Murakami, who I gather is no longer practicing, but who has long held the view that Lyme disease is greatly underdiagnosed in the province. I don't know that there is, and again, I'm trying to be entirely constructive and respectful of the member's question, because just like the member, I'm concerned about the disconnect. I just don't know how to resolve it, and I'd welcome any advice the member might have on that.
Member.
Thank you, Mr. Chairman. I think a couple of things to grasp. Everything recommends, and including the press release you were just reading from the CDC, says that diagnosis should not be dependent upon test. Diagnosis should be based on symptoms. This is a recognized disease with a symptomology. It should be diagnosed from symptoms, and that's what it says right here. It says Lyme disease should be diagnosed through a clinical evaluation of the patient's symptoms. We're not getting that. Doctors do not understand the symptoms well enough, and there has been such a chill put into this because of the line that we don't have Lyme disease in British Columbia, that doctors aren't learning, and there isn't a good vehicle for them to learn at this point, how to diagnose from symptoms. Now, Dr. Murakami was a doctor who would clinically diagnose Lyme disease, and he's the only one that I know of in British Columbia that I'm aware of who would clinically diagnose it and treat it. And what has happened as a result of that is that he has been hounded out of practice. He has, for having had the courage to diagnose from symptoms and use tests to try and confirm or not, but not be test dependent, he has been driven out of practice. So today, we do not have, that I'm aware of, a single physician in British Columbia who will clinically diagnose what everybody says should be clinically diagnosed and not be done through tests. What we have is, in a minority of cases, if cornered, doctors will do the test, and they use the BC test. Now, the problem with the BC test is it has 50% or better false negatives. So people, this is through scientific analysis. That test, which is a standard in the United States, has been examined, extensive study. In 2005, Johns Hopkins 2-year study of Lyme disease serology showed 50 to 75% of the cases where people actually have the disease, this test doesn't show it. 50% false negatives. Now, those labs that this is a hugely problematic thing in the Center for Disease Control press release, which you read out. Some private labs in the U.S. use a different standard of interpretation and thus return a false positive result on almost every test. That is categorically incorrect information. That is an attempt to portray the lab, and in this case it's the IGeneX lab in California. All of the people, the 60 cases I have, who had to go to the United States to get analysis went to the IGeneX lab in the U.S. That lab is the private lab that's being referred to here. It does not produce false positives in high numbers. In point of fact, it produces 70% shown negative of the cases that it tests. This is an outright attempt to character assassinate that lab. And interestingly, when a meeting was convened with the CDC, which I got to attend, the head of microbiology from that lab, Dr. Shaw, flew up to defend the reputation of IGeneX from this kind of information being put about. Now, it's seriously wrong. And I know enough, I'm not a doc, but I've looked into this far enough to know this is part of the defending the past analysis, which is going on in BC, which is preventing us from making progress today. We don't need the test to diagnose the disease in the first instance and provide a cure. The cure is quite simple. It's similar to syphilis because this is a similar disease to syphilis. It's simply not acknowledged as being similar. And because it's not being clinically diagnosed, people are getting chronic form of it. Now, I think the question is, how do we move it forward?